guys, this is Dr. Bidmos with Public Health Talk series. And on today's show, I will be talking about the impact of tuberculosis on health. And tuberculosis is such an important public health topic that gets little to no attention, even though it affects individuals, communities around the world, especially minority communities and low-income communities globally. And I have today, to help me facilitate the discussion, Dr. Nirali Patel. Thank you so much for joining me on today's show of Public Health Talk series.
Thank you so much, Dr. Bidmos, for inviting me to be a part of this series. It means it's a great honor for me actually to be a part of your platform.
Oh, thank you so much. Yeah. So a brief bio of you. Dr. Patel is a practicing radiologist from Mumbai, India. She has a special interest in tuberculosis and spreading awareness about the disease. She has a page on Instagram called TB Awareness, dedicated to educating people and bringing awareness to tuberculosis, which I think you're doing a fantastic job in regards to educating people and bringing awareness to this important public health topic.
Thank you so much. So can I just give you a brief as to why I started this?
Yeah.
My mother was diagnosed with tuberculosis, and before that, me being a radiologist, so my job is to diagnose patients with different sort of diseases, and TB being such a common disease in India, I have diagnosed so many patients over the course of years. But when my mom had the disease, I kind of experienced how difficult the treatment is, from a very close angle. And that sort of just brought about a completely different perspective of the disease to me, and which is why I started the whole thing, because even most doctors are not aware of how difficult the treatment for tuberculosis is for patients. And it goes on for months. It's not like it gets over in 15 days, 20 days. The treatment goes on for 6 months, 9 months, maybe a year for, other patients suffering from drug-resistant tuberculosis.
So it would depend on the patient, right? How they're responding to treatment.
Yes. So the treatment is very harsh on patients, and it affects them physically, it affects them mentally, and so as doctors, we need to be, we have to be very sensitive to these tuberculosis patients. So it just brings about a completely different side to the disease when you experience it up close, from very close quarters.
Absolutely. So on that note, so can you tell myself and my viewers on what's tuberculosis, or TB as is popularly known? What is tuberculosis?
So tuberculosis is a disease which is caused by a bacteria known as Mycobacterium tuberculosis. And to go back in history, it was discovered by a Russian physician called Robert Koch, and he named this bacillus as the tubercle bacillus. So the day he published his results that this disease is caused by a bacteria is the day we celebrate as the World Tuberculosis Day on March 24th.
Okay.
And so if you must have read in a lot of different articles, tuberculosis is also called Koch's disease, after the physician who discovered the bacteria which causes it.
Where does it come from? And I mean, what are the causes of tuberculosis?
So now that we're in the middle of this COVID pandemic, tuberculosis is kind of spread in a similar way. If a person who is suffering from TB of the lungs, coughs, so these bacteria are through the cough droplets, they are excreted out into the air, and someone in the vicinity of that person can inhale the bacteria. Now, two things can happen. If the person is extremely healthy, has a really strong immune system, the immune system keeps the bacteria in check and the disease isn't manifested in the body. But if a person has a really weak immune system, the bacteria manifests as a disease in the body. So that is how you get TB.
Okay, so I was also have ask you if you said you're comparing with the symptoms of or how people get it with COVID-19, for
Mm-hmm.
example, right? So would you say then that the person that has TB that no should wear mask in public
Uh,
to
no, not
avoid
all
it?
TB patients. No, not all TB patients should wear a mask.
Mhm.
Only if the patient has something which we call open tuberculosis, in which the patient can actively transmit the disease. Only then should the patient wear a mask. Secondly, when a patient is undergoing treatment, uh, usually after the first 1 or 2 months, that is the time if a person is having active TB, the first 1 or 2 months is the time when the patient should wear the mask, after which it is not necessary. But on a side note, even if you don't have TB, if you wear a mask, you're just protecting yourself from the bacillus entering your body. So either way, it's just a safe and good practice to wear a mask whenever you're out there in the open.
Okay, yeah. So would you say TB, because I said earlier that it's an important public health topic that receive little to no attention, right?
Mhm.
So yet it affects lots of individuals, right, and different communities, especially low-income communities around the world. So would you say then that TB is a public health issue?
TB definitely is a public health issue. Again, let me take you back in history. TB used to be present in a lot of countries in the world. TB was very prevalent in Europe. It was very widespread in the United States. In fact, London and Hamburg at one point used to be known as the capital of tuberculosis. There were so many patients suffering from TB and dying from it in these countries, in the United States and other countries of Europe. And eventually, TB has spread to a lot of countries. In fact, it is still present in these countries, but in a very, very low percentage. And countries like India, China, high population countries, um, these account for more than two-thirds of the patients with tuberculosis. So it's definitely a big public health problem in these countries. Not just India, China, but also Southeast Asian countries like Philippines, Indonesia, and of course South Africa as well has a lot of patients with tuberculosis.
So should it be why should TB be a public health concern?
As per the WHO statistics of 2018,
Mhm.
almost 10 million people all over the world had TB.
Wow.
They had fallen ill due to TB. And I think around 1.2 million deaths were due to TB in just 2018. And these were in patients which were not HIV infected. And in HIV infected individuals who also had TB, the deaths were more than around 250,000. So I think these
So are they more
statistics speak
vulnerable
for
then?
itself.
HIV,
Sorry?
HIV patients?
HIV patients are definitely more vulnerable to receive to getting infected with TB. Um, so anybody with a weak immune system
Yeah.
is more vulnerable to getting infected with tuberculosis.
Again, we can easily think of TB in terms of people with a compromised immune system.
Sure.
What
Yes.
we're going through right now with COVID. So so what are some of the preventive measures? Washing hands, or what are the preventive measures in terms of preventing ourselves, or is this something that anybody can easily get?
Again, since it is so widespread in all our communities, it's something we can easily get. Also, it's nothing to be afraid of because TB has uh, treatment. It
Mm.
is a treatable disease. It is completely treatable. Just that you have to be diagnosed in time. You have to be very regular with your medication, and it's a completely curable disease. So it's nothing to be afraid of. It's just that it is so prevalent and the treatment is so prolonged, and it not only affects the patients physically, but it affects the patients mentally, and there are so many days that a patient may have to be out of work. So it affects a it's a very all-round disease and affects a lot of different things.
Mm.
And it has economic impact as well, because if a patient is infected, may not be able to go to work, and if he is the only earning member of the family, that will affect the entire family. um, yeah, so you're missing out on job and missing out on earnings. So there are so many effects of the disease,
So
not
let me go
just
back to the mental health aspect of it.
Mhm.
So what is the connection here? Because I noticed you've mentioned a couple of times now. Like, what is the connection
Uh,
in terms of the
so
mental health?
one thing is, one of the side effects of the drugs is depression and
Mhm.
tuberculosis. Secondly is the stigma associated with the disease. So due to the lack of awareness of the disease, there is a very, very uh, the stigma is something which should be addressed immediately associated with the disease, because since people don't know, someone who is suffering from TB is stigmatized in the society. He is, people refuse to touch him, and he's put in a corner and shunned at the edge of society. um, so I mean, it is not as bad now, but things still need to go a long way. And someone who's diagnosed with TB will not want to easily share the diagnosis with a lot of people, because not many will understand what the disease is about. Because it instills a sense of fear in a lot of people, because they don't know much about the disease. Much the same way HIV had the stigma around it,
Yeah.
TB has a
Mhm.
similar sense of stigma around it as well.
Yeah. So, in other words, like, stigmatization is one of those the impacts. If you are, so would you see if you have if someone is diagnosed with TB, for example, and so would you say now that it's still a taboo to talk about this stuff in some communities?
Yes, yes, in so many communities, it's still a taboo to speak about. In fact, even educated people are sometimes hesitant to talk about TB when they're diagnosed with it. They will try and hide it as well. So, since you mentioned in the beginning that it impacts low income, groups as well, I would just like to, correct you on that. Since it is so widespread, it has spread across all social strata, right?
Oh, okay.
um, it can affect, some office going person, it can affect film stars, it can affect businessmen, it can affect anybody. So
Okay.
it's not just limited to one social group.
The reason
I'll
why
just
I
give you
said
an
that is talking about like what you mentioned in terms of the education aspect of it, like lack of educating people, because maybe the education is not reaching those communities. So
there is absolutely no awareness about the disease. Nobody is talking about the disease.
yes,
And
yeah,
this disease has been on this planet Earth since the Egyptian civilization, since the 5th century BC.
way
So
that
there
far.
have, yeah, so far back. And in fact, there have been reports which said that the mummies in the Egyptian civilization that were found, they had um, the spine was affected due to tuberculosis, and that has been confirmed as well. So we have proof that it existed way back then. And I think we've made tremendous scientific progress, but we still haven't able to,
We're not there
defeat such
yet.
a,
Yeah.
yeah,
So
we still have a long way to
we
go.
have a long way to go. And I think for the most part of it, I think health education, public health education has to kick in, in this, for the most part. So to be
The
able to educate,
first step is to raise awareness about the disease.
yeah,
And it is not many people can understand the disease and how to deal with it. Even family members who have to take care of someone who is undergoing treatment with TB, so even they need to be sensitized, they need to be educated about it. So
yeah.
a lot of work has to go first into spreading awareness of the disease.
So what about the resources also? I mean, if
Sorry.
we need to be like, in couple with raising awareness, like, gathering resources so people can have access to resources to be able to utilize, in terms of, managing, or like you said, it's not a dead sentence. People just need to understand and have idea of what this is all about, so they can care for themselves, or their loved ones can care for them.
Right,
Yeah.
right. Yeah, so they need access to the right set of tests for TB. TB
Hmm.
has to be diagnosed correctly. Another problem that we're facing is that of drug resistance
Yeah.
TB. So that is another major public health problem, which is, facing a lot of countries.
Mhm.
And So drug resistance TB also needs specialized tests, and a lot of people don't have access to it. So again, that's a major problem.
Yeah, absolutely.
So
So
yeah.
I know you've mentioned like, some group of people in terms of like, that are at risk. So, but I mean, I don't know, I just want you to like, talk a little bit about that more in terms of the people that are most at risk when it comes to TB.
So ideally, like you mentioned when we discussed, people who are suffering from HIV have
Mm-hmm.
an extremely high risk of contracting tuberculosis. Secondly is what you said again, immunocompromised patients like cancer patients or any others who have a very low immunity, they are also at a higher risk of contracting the disease. I'll tell you something. Before drugs were discovered to treat TB, the patients used to be treated in sanatoriums all over the world. There used to be sanatoriums in hill stations and up in the mountains. So the whole idea behind this was that the patients, when they were exposed to sunlight, get vitamin D and good food and good air, and that would just help make their immune system better. And once the immunity and the immune system was strong enough, then they could, help the body recover from the disease. So that was one of the treatment options before drugs were developed.
Yes. Mm-hmm.
So the concept is if you have a strong immunity, the disease will not manifest in your body.
That's interesting. You learn things every day, and that's something new to me.
Yeah.
So, what are some of the symptoms of TB?
The commonest symptom of TB is a cough, which is there for 2 weeks or more. You can have blood in your cough. You can have fever, a low-grade fever with an evening rise of fever. You can have weight loss is one of the major symptoms of TB. If you have an unexplained weight loss, a rapid weight loss over a month or two, should definitely keep tuberculosis as a differential diagnosis in your mind. If you're in a country which has TB in high prevalence,
Mm-hmm.
and yeah, so these are one of the commonest symptoms. You can sometimes have blood in your cough.
Yes, I
That
was.
is a symptom.
Yeah.
Yes,
Mm-hmm.
yes. Uh,
So,
yeah, so these are,
can somebody has TB and no don't show any symptoms? Is that possible?
yes, yes, yes. There are a lot of patients who can also have TB and they can show no symptoms as well.
Mm-hmm.
So also, some people think that TB just affects the lungs, but that's not the case. TB can affect any organ in your body from head to toe. It can affect your brain, it can affect your liver, it can affect your kidneys, it can affect bones, and any part of your body, leaving your hair and your nails. Otherwise, the disease is capable of infecting anything. That's what people don't know.
Yeah, because I mean, you're right because the common belief is that when you hear TB, you think about the lungs, right?
Lungs, yeah,
So,
yeah.
and people will say like, maybe there's a association there with chronic smokers, for example, that maybe because they have like compromised lungs, that's the reason they are showing or have signs of or symptoms of TB. How accurate is that
Right.
information?
Yeah, so even smokers are more predisposed to, being infected by TB, as with other diseases as well.
Mm-hmm.
With smokers, there's a whole different thing. They're more susceptible to develop certain cancers, tuberculosis, other sort of lung disorders as well, and the list goes on for them.
Yeah.
So
So, what is the public health implication of tuberculosis?
the thing, what people, I think, even our governments don't realize is the massive amount of money which is, spent in treating tuberculosis, and there's hardly anything which is poured into research for developing newer and safer drugs. I think to date we have 12 to 14 drugs to fight TB, and now we have certain strains of the bacteria which are resistant to all of the drugs. So imagine if someone is infected with that bacteria, it's essentially a death sentence for that patient because none of the drugs are going to work on him.
Yeah.
So more and more research needs to be done on developing better drugs. And I think, in fact, the Global Fund had pledged $10 billion to fight HIV, TB, and malaria. But this was last year, and I think with COVID, I think
into everything. Yeah.
it's going to set us back in this fight for at least 5 years, and a lot more people being infected with TB.
Yeah. So, but you mentioned your mom in the beginning. So how is she doing now?
Oh, she's completely fine, and she was lucky enough to, have. She didn't have tuberculosis of the lung. She just had TB of the lymph nodes, and she was lucky to have a a pan-sensitive strain of the bacteria, which means that she was sensitive to the first line of drugs of TB. And her treatment fortunately went on only for 6 months.
Okay.
And now she's completely fine. Yeah.
Okay, that's good. Good to hear. So that is it on today's show. Dr. Patel, thank you so much for joining me. And I think you're doing a great job in bringing awareness and educating people on.
Thank you so much. Thank you so much for having me.
Thank you. I really appreciate. That was such an educative and informative session with Dr. Patel. I want to thank her again for coming on the show to educate us and share important information on tuberculosis. And like I always say, if you have any particular public health topic that you want me to shine light on, or you want to appear on the show, please feel free to DM me and I will be more than happy to look into it. Until the next video, continue to practice the preventive measures in place, and please keep safe and stay positive. Thank you so much, Guy. Take care. Bye-bye.